Huddle is a group conversation that is very brief around issues of process or patient care. We schedule them during the day, especially when you start out with CMI. You need several huddles during the day because you're trying new processes and you have to iron out kinks. As you go further into CMI, you need less of them. And they sort of turn into more patient care related issues as you kind of get through your process work.
We do have one main person that kind of initiates a huddle, so we call them a huddle master. They basically lead the huddle, so kind of bring up the bullet points to discuss. They also look at the time because we can't be talking for like 30 minutes. So they look at what time we start, what time we end, and kind of just direct the huddle. It includes the providers that work at that station, the medical assistants, and the unit coordinator and the triage nurse. We all kind of discuss anything that's new or what we're changing. We start with any patient care needs based on phone calls that we've had during that day. We also discuss any changes that have happened in the clinic, some meetings that people didn't get to go to. We also have weekly metrics that we go off of, so any patients that we missed to with a few different topics as far as depression and hypertension and things like that. So it's a good time to kind of capture what certain patients need. We use a huddle board, so it's basically just a whiteboard, and we can post anything that we're working on, if it's nurse protocols that we're working on, and then we can update everybody as far as how that is going. Our weekly metrics go up on our huddle board. Any meetings that we have Team Compass meetings, so we post that date on there to make sure to remind everybody when that is. So it's kind of a collage of what we're working on and what we need to be reminded of.
The goal of a huddle is to, again, deal with things that emerge in the day, fix processes, work on processes, do patient care, but to kind of keep the team functioning at a really high level as you work and not waiting until things build up when you're having trouble as a team.
There's been a lot of changes since the care model redesign has started, so it's needed to have that time kind of cut out of your day. So we do block time for it. And sometimes we don't do it right at that time because everyone's busy, but we do find a point in the day to discuss what's going on. If we're trying something new and it didn't work, that's a time to discuss how to make that work better for our team. Huddles really are a people thing, but we do have some technological support. One thing that a lot of clinics are now going up on is iConnect. So that's something that we actually start our huddles off with and talk about what we call it as our hot flash. So we talk about anything that's going on clinic-wide, so not just station-wide, but anything that's going on in the clinic. And sometimes our huddles are extended via iConnect because then we can post a discussion out there and see what everybody else thinks about a certain change that we're thinking about.
Well, huddles will really actually help you get more work done during the day. You can fit in more patients and do more patient care if your team is well prepared. So just a little bit of preparation throughout the day will help you move faster when you're doing patient care. So huddle time is really well spent to increase your productivity rather than decrease it. You do have to invest time in your team. If you want your team to be high functioning, you want your patient care to go smoothly, you have to invest in the team up front to get the results on the back end. So no attention to your team is going to result in a lot more work for you. So for a provider, it's really time well spent. Good investment.
Having the provider and sometimes a triage nurse available at numerous times during the day has made a tremendous difference in patient care. You know, an example is before sometimes patients would call, we would send a message to that nurse and provider, and it's kind of phone tag sometimes. We can handle things like right as they happen.
Tips to success with a huddle: start on time, end on time, keep it quick, stand up, never huddle sitting down. It's not a meeting, it's a huddle. You should have tasks that you want to accomplish in your huddle, and you should have a huddle lead, but the person facilitating your huddle is really not directing or controlling the huddle. The whole team is participating.
Things that I have appreciated about CMI are, just working as a team and how effective that can be. I know our roles have all changed, so I've learned a lot. In my job, our triage nurse, her role has changed greatly, and it's just nice. You become closer with a different group of people, but yet you still have everybody else around you. So as a clinic, I think it's helped us grow quite a bit.